Cells which are extracted from the bone marrow are among the most pluripotent, which means can become many types of tissues, stem cells that we have in the adult human body. Now we're going to talk about bone marrow aspiration-derived stem cell therapy. Now these are really mesenchymal cells. Just like these stem cells that we get from fat, they are stem cells. They can become multiple tissues. They are more pluripotent, so they can become more tissues earlier on in the division process when they come from bone marrow. Bone marrow is not the most popular site in older people to get stem cells because the numbers diminish over time. In fact, if we do a typical bone marrow extraction, we'll get hundreds of millions of cells, nucleated cells, from that extraction. And in a young person, about 1 in every 10,000 of those cells is a true stem cell. They're called CD34s, but they are primitive stem cells that can become almost any tissue. But by the time you get to about 80 years of age, it takes 2 million nucleated cells to get a single CD34 stem cell. So when we do a bone marrow aspiration in an older individual, we could use the stem cells from it. But even though we're getting hundreds of millions of nucleated cells, you may only get 50 to 100 CD34 stem cells from it. So it's not a very good source to harvest for stem cells in older people, particularly knowing that you get between 50,000 and 500,000 stem cells from a cc of fat that we take out. That being said, the stem cells that you get from the bone marrow are clearly better. Now, we do the bone marrow aspiration right here in the office. Now, some of the abbreviations that you'll see are BMA, which is bone marrow aspiration, and bone marrow concentrate, which is BMC. That's what we want. So under local anesthesia here in the office, we do bone marrow aspirations and we get about 50 cc's of bone marrow from the bone marrow. We have a way to filter that, centrifuge it, and then collect the nucleated cells off the top, hopefully without it clotting. Those nucleated cells contain all of the stem cells. If we put that back into, for instance, an arthritic joint, like a hip or a knee or a shoulder, and then stimulate that with the platelets from platelet-rich plasma, then those cells attach to the local tissue, and through signaling proteins and some other environmental stimuli, they become the local tissue that we're trying to recreate. We don't know what percentage of the time this happens, but it's enough that we can actually measure it. It has been biopsy proven with arthroscopic surgery to biopsy those areas in question. But by stimulating it with the platelets, those stem cells become the local tissue. They grow a thin layer or a membrane of that tissue, for instance on a joint surface as cartilage. And then we come back in a month when all those platelets have died, and we hit it with just the platelets again to continue the stimulation process. And then over the time of months to even possibly early years, people get continued growth of those tissues and continued repair of the local structures that have been damaged. It works about 80% of the time, and coupled with other therapies, most people, if they're willing to undergo stem cell therapy, in addition to the other things, can avoid surgery for years, where otherwise we previously had very few options for that. Well, I hope you learned something from that. We certainly appreciate your being with us. I am Dr. Ron Gardner with Gardner Orthopedics.